Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm here today with Renee Flacking, and we're going to talk about her upcoming presentation, Closeness and Separation, and its importance for parenting and feeding in the NICUs. Welcome, Renee.
Thank you.
It's so good to have you here with us today. I know you are very, very busy, so we appreciate it that you were able to come and sit with us and just answer a few quick questions and talk about your presentation. So, but before we jump into the topic, can you tell our listeners a little bit about yourself and your professional journey?
Yeah, I will. Thank you for having me. It's really an honor to be invited. I've seen so much about the Gold Neonatal for, well, last year and previous Gold sessions, so it's an honor to be here. I'm a professor in pediatric nursing. I used to work as a neonatal nurse in neonatal units for more than 10, 15 years. And then I moved into research because there were so many areas to be improved. Breastfeeding has been my initiation point. That's where I started. I was really interested in breastfeeding, but that has developed into more into parenting and the design of neonatal units and how we can support parents while they're in the neonatal unit and after discharge. Um, so I worked for as when I stopped working as a neonatal nurse, I started doing research, and I did that for some years at Uppsala University in Sweden. I did a postdoc in England, and then I now am the leader for a research center, reproductive infant and child health, here at Dalarna University, Sweden.
Well, thank you for sharing that with us, Renee. You certainly have a very impressive background and lots of research experience there as hands-on skill experience. So thank you for sharing that with us. Now, your presentation is titled Closeness and Separation and Its Importance for Parenting and Feeding in NICUs. And you explained a little bit how your first interest in feeding were nursing and then widened and broadened to also parenting. So tell us a little bit about that topic you're presenting on and why you think it is so important.
I think we're at the point right now in neonatal care where we have a huge change, a paradigm shift really from open bay units to single care room for parents and children. So that's a huge shift. But why is this happening? What is the effects of being close and what is the effects of separation? And through the studies I've done, I've come about some important findings that I'd like to share with the audience. So we're going to be talking about these emotional and physical effects of parent-infant closeness and how parents perceive emotional closeness. Because everything is not just physical closeness, it's about being emotionally close as well. And although they are quite linked, they are not necessarily the same, or you can feel physically close but not emotionally close, and vice versa. And so we're going to be talking a lot about the designs of neonatal units and how that influence parenting and feeding.
Thank you for explaining that to us a little bit about your topic. And I find it very interesting because you mentioned that paradigm shift there from how NICU units are set up from that open floor area now to more enclosed areas, and you took the time to conduct research on that and how it affects the parents and the families in that situation who have their loved one, their baby in the NICU. So thank you. I'm really looking very much forward to this presentation, and will certainly learn a lot. And I know you're busy, so I don't want to keep you much longer. But before I let you go, can you tell our listeners a little bit about what would you like our delegates to take away from this presentation?
I would be happy if the delegates would experience that they gained knowledge on these effects, but also to get a more creative and reflective mindset about how we can change designs, not necessarily just to rebuild, but actually using the um, furniture and the screens and how we can use that to accommodate more the sense of being more close to the baby. So creative thinking and to reflect on the care that we provide, that would be brilliant.
Thank you very much, Renee. That sounds wonderful. I can't wait for your presentation and see what we can do to improve setups in the NICU here and worldwide. So thank you for chatting with me today, Renee.
Thank you for having me.
And Renee's presentation, Closeness and Separation and Its Importance for Parenting and Feeding in NICUs, is part of the Gold Neonatal Online Conference 2018. Renee's presentation will be live on June 11th. And this is for our listeners now. For more information on this presentation, when it's being held in your time zone, and on the other presentations in the Gold Neonatal Conference, please visit goldneonatal.com. Thank you all for listening. Have a wonderful day. Bye-bye.